Hi everyone, welcome back to an episode of Ask Dr. Nick. My name is Dr. Nick Schmilekoffer and I work for the Neurologic Wellness Institute. And on today's episode, we're answering the question, should eye movement training be used in acute stroke? And this is something that is an interesting question because eye movement training, or let's say physical therapy in general, is not necessarily used for acute situations, acute stroke, acute traumatic brain injury. Generally, the therapies are going to be medications to break up clots, to thin the blood, maybe surgery to release blood that might be clotting, or release blood that is hemorrhagic in the brain or basically pooling up in the brain, but generally not exercises. Okay, so however, a study from 2016 with acute stroke patients in a hospital using eye movement training did show benefit in different stroke scale markers. So I want to get to the paper and we'll kind of just talk about the abstract here. It is a pretty intense paper, but I'll describe kind of what they did and what they found here. So 2016, again, it's called Eye Movement Training Results in Changes in QEEG, so quantified electroencephalogram, or like looking at brain waves, and the National Institutes of Health Stroke Scale in subjects suffering from acute middle cerebral artery ischemic stroke. It's a randomized controlled trial. Acute middle cerebral artery, acute meaning it's just recent. Middle cerebral artery is the one that mostly supplies the outer parts of the brain, so either the right side or the left side. And it's ischemic, which means there was a blood clot in that middle cerebral artery. It is actually by Dr. Frederick Carrick, and so he is the father of functionality from the Carrick Institute in Cape Canaveral, Florida. And so we learn a lot of information from Dr. Carrick in regards to eye training and exercises. And so if we look at the abstract here, we can discuss it here. So eye movement training can induce altered brain activation and change in functionality of saccades, so quick, fast eye movements, and changes of the brain in general. So the objective of this study was to determine if eye movement training would result in changes in the quantified electroencephalogram, like again, brain waves, or the NIH stroke scale in patients suffering from acute middle cerebral artery infarction. It's a double-blind trial, 34 subjects with acute middle cerebral artery stroke. The control group had just aspirin each day, while the treatment group were treated with aspirin plus the eye movement training. They looked specifically at the QEEG measures of the delta alpha ratio and the power ratio index and brain symmetry as calculated by the QEEG, and then the stroke scale by the NIH. So what did they exactly do with the eye movement training? Again, it's not in the abstract, but obviously it's in the paper. So if somebody had a right brain middle cerebral artery stroke, then they did specific saccades called gap saccades, basically meaning that the target that they were going to look at was going to be extinguished or move away before the next target pops up. And so for the right brain, they would look at basically targets that go up, and as the next one goes, the next one comes away. And so to go up and to the left, and then follow the dot down and right. Up and left, down and right. Up and left saccades or jumping fast, down and right pursuits or smoothly following or tracking. If it was in the left side, it would just be the opposite way. Up and right versus smooth pursuit, down and left. And so this is what they did. They did 3 reps of that, 3 sets, a couple times a day. And what were the results? They found that in the eye movement training group, there was a strong statistical significance and improvement in all outcome measures for the group with the eye movement training. Such improvements were not observed in the control group. So basically what that means is the delta alpha ratio, the power ratio index, the brain symmetry index by the QEEG were all greatly improved in these stroke patients. Their stroke scale was also improved. So basically they concluded that the addition of eye movement training to middle cerebral artery ischemic stroke treatment paradigm has demonstration of significant changes to the outcome measures and it's a very low cost, safe, and effective standard treatment, or complement to the standard treatment that's already being delivered. So if we bring it back, basically the answer to this question is, I think yes, all patients, whether it's maybe stroke, maybe traumatic brain injury, should be getting simple eye movement training exercises, as long as they're not done to the point of exhaustion, right? This was not, they were able to look at the metabolic capacity and do these exercises without draining the individual, draining the patient. So if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.